chat up until then, and I
Okay.
have a couple of
So
upcoming
I've
events.
started recording, so just so you know. And now I'm gonna go and start the live. Give me just a minute and I'll have that done.
I like the way you guys are running a little late getting started. This just is further proof that you are my tribe, my people. I love it.
I agree. Well, and I'll tell you, all of our presenters, that no matter how many we have on today, we have been learning throughout the pandemic that we have more people join us than normal. They just join later. They watch us on. We have a YouTube channel, and this is going to go up on our YouTube channel. And we have been getting many, probably many multiples of our normal meeting populations watching our YouTube channel and watching us on Zoom and Facebook Live. So the number of people here does not represent how many people are going to be seeing this soon.
Well, that kind of scares me. I don't know if on the recording they can see the chat. Probably they can. I don't know, but just in case they can, I'm going to put my email on here. That way, I'm hoping people will interrupt us with questions and comments. So that's the best part of this.
Yes.
People that are here live, but for people that are watching it after the fact, if you want to correct me about something or sort of teach me about how your experience is different from what I'm talking about or challenge me, we're always open to that. And probably the best way to get in touch with me is my email. It's myrabeth.bundy@eku.edu. If you are watching this and recording and you have something you want to share or quarrel about, don't quarrel in silence. Email me. I love to hear other people's perspectives. We'll do the best we can to share some things that we know, but I'm sure some people watching will have other experiences and other things they want to add.
This has been the strangest workshop experience, because I was telling my family last night, normally I'd be getting to, well, I would have sought a venue out a while back and done all that preparation, and I would have been there already a couple of hours. I would have made coffee. I would have put out all the, so sorry, I can't offer any coffee to anyone and treats, the usual breakfast treats. And I would never have done it for just 2 hours, because all that effort for, okay, good. Mary, me too. I have mine.
We should be live now, and I'm just checking to make sure that we are.
Okay. And then we would have not done it for 2 hours. We would have not done all that work for just 2 hours. We would have had a full day. We would have had lunch in the middle. So this is a lot easier for me, and for all of us to have gotten there. We would probably had to cancel because of ice.
And it's kind of cozy. I mean, I got to visit with Callie this morning and Vol.
Right.
There's really some benefits. So Joe, as comments come up on Facebook Live, I guess, will you text me anything or just interrupt me with anything?
Usually what I do is I put that in the chat box. Whatever people are asking, I go ahead and put that in the chat box.
That's great. I just want people to be able to give input, because again, what we're doing is just a little sampling of information about anxiety, and I know people in your audience have valuable perspectives to add.
Okay, I guess we are ready tech-wise, and we'll go ahead and get started. I'm Sarah Spraggins. I'm president of the Autism Society of the Bluegrass, and I'm joined by Joe Grayson, another one of our members, and several other of our members, but Joe Grayson is helping to put this on with our technology. She is our technology team at this moment. And I'll tell you briefly that some of our upcoming events, our meeting this month, we meet the last Monday of each month, except for May because of Memorial Day, and we combine our November, December meetings the first Monday of December. But this month's meeting is February 22nd, and we'll be joined by Marissa Webb of Lexington's Human Rights Commission, and she's going to be talking about social support service animals and housing. And I think that she's going to address issues that people have in their housing legal rights and their service animals. And then our meeting, I think, and our meeting planner is on this call, Melanie Tyner Wilson. She can correct me on this, but I think our March meeting is Dr. Paul Wayman of Virginia Commonwealth University. He will discuss employment and people with significant support needs. Then following that, our April meeting, I believe, and I have two people on this meeting who can correct this. We will have Dr. Myra Bundy on obtaining an ASD diagnosis in adulthood. And we get a lot of questions from people who are adults and who need to seek a diagnosis, and it is not easy to find. I was just on a meeting a couple of days ago with the Kentucky ACA, the Autism Commission, and they were trying to sort of list where people can go, and the list is very short. So, and if we have, we would like to hear from everyone on meeting topics that they're interested in. We want to put out content that is of use to everyone, and we can't know that without your input. So if anybody out there has suggestions for topics that they would like to see covered that are of importance in their families, please let us know. You can put it in the chat or you can email afterward. But we'll go ahead and move on with today's workshop. And our topic today is anxiety and autism. And we are joined by Dr. Myra Beth Bundy of the Eastern Kentucky University Psychology Program and her master's students. And Dr. Bundy, how many do we have on this call from your program?
They're doctoral students.
Oh,
We used to have a master's program, but now we have a master's program in applied behavior analysis, but our clinical psychology program is doctoral. Gosh, let's see. I might be wrong. I'm not sure how many. I think I have 5 co-presenters. I'm gonna have to go across the boxes. And then some of my students are here watching us. They just can't get enough of hearing me. They miss me on the weekends, and so they're here to hear me some more. I feel sorry for them. So can I introduce myself and my fellow students?
Please go. I want to thank all of you for being here. I want to thank our attendees as well, but Dr. Bundy and all the students here, thank you so much for joining us. We want to be able to put out content during the coronavirus in any time, but it's been really hard, and we're just glad to have you join us and give us so much valuable content. Thank you so much for being here.
It's a pleasure. So I'm Myra Bundy. I'm a clinical psychologist and a board certified behavior analyst. I've been working and meeting and enjoying getting to know and learning from people with autism for a very long time. I don't know how long, probably about 30 years. So most of what I know, I have been taught by people on the autism spectrum and their families. I would say about 95% of what I know. So I'm just a really older person that's had the benefit of years of experience. And if you listen, that's how you'll learn. So I want to introduce my student team. I'm going to talk about anxiety in general. And by the way, I know the title is Anxiety and Autism, but every time I look at this, I learn a lot about myself. So if you're a parent who's here, this will be completely applicable to your life or really to anybody's life. It's not, I mean, there are some autism informed things that we're going to talk about, but anxiety is a part of everybody's life. So I hope it'll be interesting for us to think about anxiety. I was thinking about it this morning. I did an indoor bike ride to kind of kick this off. I had to leave it early, you guys. So now I'm going to have to walk extra steps. But I did an indoor bike ride. And as I was doing it, I was thinking, hey, this is going to get me really relaxed for the talk. What a good idea. I have sort of an anxiety, like a really, an interview that I dread coming up in a couple weeks, and I was realizing I should probably get on and do a bike ride before I do that interview, because that's a great way to discharge some anxiety, right? Being active, exercise. It's hard when it's cold the way it is in Kentucky right now. So I have this little indoor exercise bike. So anyway, all kinds of little tips like that. All right, I see Joe. I keep thinking she's a presenter. She's just the wizard behind the presenters. I've got Krista Neville here. Can you wave, Krista? So Krista is one of our PsyD students. She's my teaching assistant, so she helps me with all of my teaching. I teach an autism class. I'm teaching a class right now on intellectual and developmental disabilities that Krista is helping with. She is a really great child therapist. She has an expertise in working with kids with anger challenges. So that's sort of one of her emerging specialties. Then you can, I don't know if it's the same order on your side as it is on mine. Gabby Martin, wave your hand, Gabby. So Gabby is my right-hand woman in my private practice. And Gabby coordinated, I don't know if you guys saw, I'm sure we publicized this on ASBG. We did a series, we did 2 of Lisa Rubel's Sea Hope groups via Zoom. We did one in the summer and one in the fall. It's a parent group where you focus in on targeting specific behaviors that your child has that you and your child would like to either increase or decrease, so it might be increasing taking turns or a decreasing frustration, something like that. Then we keep data and we figure out behavior support plans. And we also teach parents to understand autism as deeply as we can. So Gabby has coordinated 2 rounds of that, and that's one of her special contributions. All right, now we've got Tara Board. It just says Tara, wave your hand, Tara. Tara is a student that Tara and I have been to Austria together. So we have a special bond over a travel class that we took together. Gosh, Tara, what can I say about your skills? Tara is, of course, in the field of psychology, but she's been learning a lot lately about social work, about all kinds of different resources in the community to help kids. One thing I can tell you about Tara is that if there's a child that needs something, Tara will spend all her time and leave no stone unturned to try to get resources for that child. So I really admire that about her. Now we have Molly King. Wave your hand, Molly King. Molly King. So see, everybody has a special skill in my team. This is the best team of people I could possibly have. Molly has been running all of our groups for teenagers on the autism spectrum, and she has become an expert at online games, online activities, really fun ways to spend time together on Zoom. These kids do, probably somewhat boring school Zooms all day, and then they sign on with us on Friday evenings, and they don't mind because Molly makes it so fun. Is that everybody? Have I hit everybody? I know I have more students, but I think everybody else is a watcher rather than, no, I've got Kristen. So Kristen and I started this presentation, what, Kristen, maybe 3 years ago? So this is, our in graduate school, your students turn over. So most of this group is a new presentation group, but Kristen and I have been doing it for years. Kristen is part of an autism family. So she's got a family perspective as well as a practitioner perspective. She's the funniest person. She's really a lot of fun to hang out with. She works with a child refugee population in Lexington, doing amazing, really life-saving work for those kids through mental health supports. And she's going to be doing autism work for the rest of her life. And actually, she's on her internship, we're hoping that she gets to do a whole year of nothing but autism and developmental disability specialty training. She's going to be somebody great in the field. Okay, so now that I've hyped everybody up, hopefully we can teach you some cool stuff in this presentation. Are we ready to start we've got PowerPoints. I know that's not the most fascinating thing, but I think it might be helpful for you to see a little bit on the screen as you hear us talk. We have some pictures and it's not all words. All right, there we go. So the first thing I want you to notice is that my title was chosen very carefully. The title isn't Beat Anxiety, Get Rid of Anxiety, Anxiety No More, right? We hate anxiety. No, it's Anxiety, Strategies for Understanding and Living Well, because we all live with anxiety. And in fact, sometimes if you fight or resist anxiety, uh, your anxiety causes you more problems than if you can live with anxiety well, understand your anxiety, recognize it, respect your anxiety, label your anxiety. So I just want to start this whole thing off by saying that we are not eliminating anxiety. We're working with it. I hope that makes sense. And we, as I said, we have done this presentation a few times. So some people that helped contribute to it originally are in different places now. Dr. Shirley O'Brien is an occupational therapist. So even though we're all psychologists today, we have had an OT be part of the development of this talk. Brooke Maupin is in Alaska, flying to very rural locations to provide support, mental health support. Isn't that kind of cool? Sarah Critchfield is at the Kennedy Krieger Center right now in Baltimore, and Allison Simpson is in a community mental health center in Pennsylvania. So those people aren't with us today, but we appreciate the work that they put into the original presentation. So here's what we're going to try to do. Hopefully you're going to learn about and identify some stress management, stress understanding techniques to help you live with your anxiety and maybe help a family member. I'm hoping some of my students in particular will have you practice some of the stress management stuff. So maybe we'll all leave here today. Well, actually, I may put you to sleep, so you're going to leave here really relaxed. But other than that, hopefully we'll practice some things that might be handy for you to use in the future. And then we're going to talk about internal body cues that may lead to anxiety. And I'm going to try to help you understand how anxiety works in the body and mind so that we can have you have some tips to support healthy mind, body, and spirit for you and your family. What could be better than that? Introduction to anxiety. So what is it? Well, anxiety, and again, this is why we don't want to beat or eliminate anxiety. Anxiety is an adaptive emotional response. Sometimes people can run into problems because they don't have enough anxiety. People with sociopathic tendencies may have some problems because of that. So anxiety is our body and brain's way to respond to danger or things that we may perceive to be dangerous. It's our brain's and body's way to tell us, be careful, be cautious, take your time in proceeding. So I will often divide understanding or recognizing anxiety into motor responses, physiological responses, and subjective responses. You know, it kind of depends on whether you're trying to identify or sort of informally assess for anxiety in yourself or in someone else, especially if you're working with someone else who may not be able to state, or describe their anxiety or recognize it. You might use some of these cues to say, oh, this person might be anxious. So I have a whole list here. Now, I think everybody varies. Some people are more in touch with their anxiety responses than others. Will you go back to that one just for a second, Tara? So I'm a person that will often, I was raised in a very, context is really important to anxiety. Sometimes our biology can be set up. We might be at risk for anxiety responses through some of our biology, but also context, current context, and our raising context might put us at risk. I was raised in a really anxious household. My mother is a really kind and loving person, but her danger perception is really high. So she saw a lot of neutral situations as dangerous. So somehow that led to me not always recognizing my own anxiety. So I'm a person that if you look at that middle column, sometimes for me, the first awareness I get is, why is my body so stiff? Why am I breathing funny? And why am I sweating? And then I have to, through years of practice, I realize, oh, I think I must be anxious. Then I can cue in and say, well, what am I thinking? So it may be different for you. It may be different for your family member. Maybe you see motor first. Maybe you start thinking these things first. Maybe your body starts doing it first, but any of these or all at once could be a cue that someone is experiencing anxiety. It's especially important when we're dealing with kids or when we're dealing with somebody who's less able to express themselves verbally, because also the motor responses might look like aggression, right? Or quote, bad behavior, when actually what's underlying the behavior is anxiety. I'll tell you somebody I've learned from that's really good at piecing this out. I don't know if any of you have ever worked with Gail Williams, Dr. Gail Williams at University of Louisville. I've noticed that often I will be on a track thinking about a child's problem behavior. And then Dr. Williams will say, Dr. Bundy, it's anxiety that's driving that behavior. And I'm like, oh, you're right. You're so right. She has a really sensitive way to pick up on underlying anxiety. I think in autism, anxiety is very often, if not usually, behind behavior. You know, it's one of the driving factors behind behaviors of concern. All right, let's see. What do we got next, Tara? So anxiety could be a problem if it's out of proportion to the danger, because what can happen then is if the person's perceiving danger when there really isn't any, then the person might miss out on a lot of situations that they might need to be in, or that might be fun to them or rewarding, or that a family member wants to be part of. You know, you've heard of FOMO. Anxiety could be a problem if it leads to missing out on things that are needed or desired. And anxiety can be problematic if it's distressing the person or their, you know, their loved ones, the people that are living with them, when it's impairing. And so if those kinds of things are going on with anxiety, it's possible that the individual has an anxiety disorder. And I certainly have anxiety that's high, probably always. I'm sure one of my students could diagnose me with an anxiety disorder. I just kind of live with it. And I think I'm living pretty well with it. Maybe because I'm a psychologist, I've educated myself a lot, and I have a lot of strategies for addressing my anxiety when I need to. So that to me, that is a great goal. That's where you want to be. So these are some official anxiety disorders. Again, I don't get super hung up on this. It might be helpful to see the different ways that anxiety can present. Separation anxiety disorder is just when primarily children have a really difficult time separating from their family when they need to. They might have trouble going to school. Maybe they can't be in another room. Maybe their parents and they would like to have their own bedrooms or their own beds, but they can't tolerate that amount of separation. Sometimes people with separation anxiety worry a lot about what might happen to their loved ones when they're separate from them, so they can't, you know, they can't enjoy themselves when they're separated because of their worry. So that's separation anxiety disorder. Selective mutism is a condition in which people are able to use words, but they don't because they are too anxious to use their words in situations in which they would like to use their words, like at school or in the workplace or some other time when they might need to use words. Agoraphobia is a condition in which people feel so anxious about leaving their home or maybe leaving their immediate community that they can't go places that they would like to go. I have certainly seen this in some adults on the autism spectrum, not all the time, but it's definitely out there. Panic disorder is just, if you think about those three columns that I showed you earlier, the thoughts, the motor responses, and the physiological responses, panic disorder kind of looks like a very high degree of all of those things at once. And it's scary sometimes to the people around the person that's panicking. And inside the person that's panicking, it usually feels really negative and scary. Sometimes people even think they're having a heart attack or some kind of a medical event when they're panicking. And some of these things go together. For somebody who's agoraphobic, if they try to leave their house or their room or their yard, then they might experience the symptoms of panic. So then they go back home. Social anxiety disorder is one that I see a lot of times. It seems like a lot of adult women will come to see me, and the question is, do I have autism? You know, am I on the autism spectrum, or do I have social anxiety, you know, or some combination of the two? So social anxiety is just being really worried about what people think about you, worried about others' judgment about you, worried that what you're doing is not right socially. We all experience this at times. A lot of times the teenage years are a common time for a big spike in social anxiety. But people that continue to experience this through their whole life and have life problems because of it might have this disorder. Generalized anxiety disorder just kind of fits in with somebody who's a worrier. Does anybody have anybody in their family, or maybe you yourself, that you would just describe as they're a quote worrier? That's how I think of generalized anxiety. And that's probably what was true for my mom. If it could be worried about, she would worry about it. She's been a nervous wreck during the COVID pandemic, worried about, yeah, Joe said, I'm a quote worrier. Well, it's good to meet another warrior, Joe. That's why you and I get along so well together, I think. So generalized anxiety and specific phobia. Let's see if we have any of that in the audience. Specific phobia is when you're not necessarily a general worrier, or maybe you are a general worrier, but there's some things in particular that you just cannot tolerate or that cause some really intense anxiety responses. Now, I tell you, I've been hearing a lot about, Kelsey says she's a general worrier too. There are some, yeah, some of my best friends are worriers. So for specific phobia, injections, I've heard a lot of people talk about that because of the COVID vaccine. Some people will be like, oh, I can't wait to get the COVID vaccine. I can't wait till it's available. And then you'll hear other people on your Zoom meeting say, oh, I'm afraid of injections. I don't get shots. And so, that's your cue. Oh, if this person would rather die of COVID potentially than get a shot, they might have a specific phobia. And phobias are not unusual out there. It's just a question of whether the phobia is stopping you from meeting your outcomes. Oh, love it. We've got a poll here. I know it's yes for me. What about anybody else want to talk about things they're a little phobic about? Gosh, what would it be for me? There are some that there are some phobias that are kind of particularly common because we've evolved, as humans to avoid these potentially dangerous things. Okay, yeah, travel. I can get excited, but also anxious with traveling. So yeah, traveling, snakes. So Sarah, that's a great example. Snakes, because if you think about from an evolutionary standpoint, being afraid of snakes, really, everything you guys are bringing up could have an evolutionary basis. With travel, that's evolved because if you go into a new environment, right, it's wise to be careful. So we have 83% worriers in our group. Snakes, of course, if you avoid snakes, you're more likely to live to reproduce, right? So Gayla, mother anxiety about the well-being of their child. If mothers that are anxious and careful about their kids are more likely to have their kids live, right, to reproduce. Spiders, Lori, of course, people that avoid spiders are more likely to live to reproduce. So, someone was mentioning separation anxiety. Of course, that's evolved because children who stay close to their parents, especially young children, they're more likely to live, right? So we can see how it's maybe our own personal biology, the way we were raised, and the things that we heard people say, anxiety wise, about danger in our world, but also just as a group, the wider group of human beings have evolved to be able to easily pick up, to be easily conditioned to fear certain things. So it's fascinating to see how it all plays out. Obsessive compulsive disorder, I think in the new DSM, it's not in the anxiety category, but I think obsessive compulsive disorder has its roots in anxiety because we may feel anxious. We have some anxious thoughts. And then when we engage in compulsive behaviors, like washing our hands or checking to see if the door is, locked, or I don't know what else. We all have our own little compulsive behaviors. When we do those, then our anxiety is relieved. So I think OCD to me kind of fits in with anxiety disorders. Now, I want to tell you something that I say to a lot of the clients that I see. My students have heard this a million times, and you guys can see how this feels to you. Well, right, And I'm sure OCD is really through the roof for people right now because of the when you are living in a global pandemic, you can imagine how everybody's anxiety could be up. And that's what I was going to say. I think that anxiety, I always think of it as a river, a subterranean river. I should have a picture of this. Anxiety is a subterranean river. When our anxiety is low, we don't have a lot of these specific symptoms. But when our anxiety goes high, then we're more likely to see some of these symptoms popping up. So if I'm pretty relaxed, I may just be living my best life. But if my anxiety goes up, then I may not be able to, maybe more likely to show a compulsive behavior, like washing my hands a lot. That's absolutely true for me.
Dr. Bundy, we have a question from
Yes.
Facebook Live, and I just posted it in the chat.
Let's see. Yeah, absolutely. Can a phobia present itself only around drains? A phobia could be anything. Tubs, sinks, sure. So it may be something about the sound of a drain. It could be a fear left over from childhood about going down the drain, right? Or going down the toilet. Yes. So the cool thing about autism is, just as interests can be unusual, fears could be a little bit unusual too. So while everybody's heard of somebody who is afraid of being dirty and washes their hands, we may not hear about people being worried about drains, but hey, this is autism we're talking about. So there could be some specific and some unusual things with autism. And I probably have a slide on this later, but I'll talk about it now. In ASD, because we have sensory sensitivities, we may have people that are particularly nervous and likely to develop fears around certain sensory experiences because their body is really sensitive to those. Oh yeah, Kelsey's talking about an allergy. Absolutely, Kelsey, that's the perfect setting to be anxious. I mean, I could see how if I don't have a peanut allergy, but if I did, I'm sure I'd be compulsively washing my hands and worrying about coming in contact with peanuts. So there are certain circumstances in our life that might make us more likely to jump in and feel anxious. And again, when that subterranean river of anxiety is higher, then we are more likely to see the specific symptoms. So let's say hypothetically that I'm a person that's likely to be anxious and wash my hands, worry about germs and wash my hands. If I'm feeling cool, calm, and collected and I'm on vacation, you're not going to see a lot of that hand washing symptom because the subterranean river of anxiety is low. But if the water's rising, let's say, for example, I have an interview for foundation professor at EKU coming up in a week, which I do. Well, probably my river of anxiety is going up as I think about that coming up. So what I'm going to do in the next week is do some extra relaxing strategies, extra mindfulness, all these things that my students are going to talk about. I'm going to do extra versions of those to keep my river of anxiety low so that when I get in that interview, I don't, I have to excuse myself and wash my hands or panic, or do any of these specific kind of anxiety kind of behaviors. Yeah, gluten sensitivity, I can see that. Yeah, so that, people could have some social anxiety that could make it difficult to be around other people. We can really see all the different ways that anxiety could impact our life. Okay, what do I have next? Sometimes I can't even remember my own slides, so I'm as surprised as you guys to see what's coming up next. Okay, so drivers for anxiety. We've talked about this a little bit. There certainly is some evolutionary backing behind anxiety, and there can be biological differences between people anxiety-wise, but also anxiety is a learned and a practice response. It can occur through modeling. Does anybody know what modeling is? What is modeling? I know my students know. Students, you're going to give me crickets? Come on, JP, type in the chat box. What is modeling? I'm going to have to call on people here. No, JP's not coming. How about Tyler McQueen? Tyler, what's modeling? I actually don't really have a formal definition of it in my mind right now. Exactly, Joe. Thank you. It's just modeling is when you see somebody else behave in a certain way and you imitate them, because human beings are very prone to imitation, both specific behavior generally. Yeah, everybody does it all the time. And a lot of times we use modeling to try to teach people new skills, but yeah, that's right. So we can do modeling on purpose, or we can also do modeling accidentally. So if I was working with Thatcher and I said, Thatcher, say hi, Thatcher, wave your hand, that would be me purposefully modeling something. I'm trying to get Thatcher to greet somebody, right? But I might also accidentally model something for a child that I didn't mean to model, you know? So if I am walking around my house saying, oh my gosh, it's a global pandemic. Oh, we're not going to survive. Oh no. Oh my gosh, I feel so nervous. I can't breathe. Well, I'm accidentally modeling some anxious behavior for other people in my household, right? So modeling can be, oh, no problem, Tyler. I'm just picking on you guys. Yeah, so that's funny, Joe. Maybe not to you, but that's interesting. Let's put it that way. So modeling is going on all
Oh,
the
no, it's
time.
funny.
And sometimes we may be modeling behavior that we're not aware of. And I have to watch that because I'm a worrier and I want to limit how much I pass that worrying on to my kids. So I try to, try to control how much of a model for worrying I am. Even if I look anxious, I try to make my statements be more the statements I want to have my kids say. So I might be thinking, oh no, we're not going to survive this pandemic. But what I want to say is we'll learn as much as we can about COVID-19 and then we'll change our, we'll make our behavior fit the circumstances so we can be as safe as possible. We will work to be safe. So even though I'm maybe feeling one way, I can change my words so that my kids have some different kinds of words to model. So we learn about anxiety through classical or respondent conditioning, and that's stimulus-stimulus pairing. Have y'all ever heard of Little Albert? I don't know if y'all have heard. Absolutely, Chastity. Chastity's helping me out from Facebook Live. What about Little Albert? Little Albert, John Watson was trying to learn about anxiety. So he took a cute little baby named Little Albert and he showed him a white rat. And little Albert was young enough that he didn't know to be scared of rats. And he just wanted to reach out and touch its soft fur and make little cooing sounds. Then John Watson did a stimulus-stimulus pairing where he dropped something and made a very loud sound at the very same time he presented the rat, or just before he presented the rat to little Albert. And he did that stimulus-stimulus pairing over and over and over again. After he's paired the loud noise and the rat, let's say he did it 15 times. Then when you brought out only the rat to little Albert, how do you guys think little Albert reacted? So he was initially interested in the rat. Then we paired the rat with a very loud sound many times. After that pairing, exactly, Mary. So then little Albert was scared. So Watson, cruelly, of course, had learned about classical conditioning. If you pair a neutral stimulus with a scary and naturally scary stimulus over time, that neutral stimulus will become scary. So, let's say, for example, Walmart. Walmart building is the Walmart building. But if you pair that Walmart door with a lot of overwhelming sensory stimuli, bright lights, fluorescent lights, lots of people, really loud sounds, over time, you might have somebody that tantrums with fear every time you come into the Walmart parking lot or as soon as you hit the Walmart door. Does that make sense, guys? How that the pairing of all those stimuli and the Walmart building could cause Walmart itself to become a scary stimulus. Same could be true of an open gym. Yeah, I mean, again, there's genetics, but I'm talking about the learning part of it too. So it's probably, anxiety is complex. So it's probably multiple factors that lead to some people being more anxious than others. So that's classical conditioning. Now I'm going to talk to you about operant conditioning, and I'm hoping I can come up with an example that you guys can relate to. So in classical conditioning, two stimuli are, yeah, exactly, Chastity, because you've heard that sound has been paired with the rat in the past. So when you see the rat, you automatically have this fear response. So operant conditioning is response stimulus pairing. And there's a guy named B.F. Skinner that studied this, but I'm going to try to give you an example that might relate to your real life. I'm trying to think of a common operant learned fear. Well, we could think of fear of flying. You step into an airplane. That's the response part. And then then your world tilts and you start hearing some crazy sounds and you get a vibration through your whole body, an unpleasant host of sensations. So that would be operant conditioning. Your response was to walk into the airplane. Then the stimuli was all those, weird sensations in your body. In the future, so that walking onto the airplane was punished by all those sensations. In the future, you're like, I can't get on an airplane, or I've gone through security, but I can't quite bring myself to step onto that plane. So that might be how fear of flying. So there's this interesting theory. And by the way, this is some sort of complex theoretical descriptions of anxiety. My students are going to give you some more practical tips. If this is confusing to you or over your head, feel free to ignore me. My students ignore me all the time. So it's okay. Just join my students in ignoring me. I'm going to tell you probably what's the most cognitively complex thing we're going to talk about today. And it's Mauer's that's funny. I said it's a two-factory theory, but it's actually a two-factor theory. Maurer says that we use both classical conditioning and operant conditioning to create, really serious, intense anxiety or fears. I think it's on the next slide, Tara. Nick says he doesn't ever ignore me. That's very nice of you to say so, Nick. All right, so two-factor theory. Yeah, Jo says she doesn't ignore me. She just disagrees with me. I love when people fight with me. That's good, Jo. That's how I learn. So here's the two-factor theory. So I'm going to go through this theory and then I'm going to take an example and do it. And I think we're going to do a fear of flying, or we might do a fear of Walmart, just because I think in the autism community, we have quite a few people that can struggle to go into a place like Walmart. So the first factor is we have a neutral object paired with fear-inducing stimuli. So we have the Walmart building. This person has been indoors many times. There's nothing inherently scary about a building going in a door. So that's the neutral object. The fear-inducing stimuli, I think, is all the loud sounds in Walmart, all the people moving around and the bright lights. So over time, that Walmart parking lot or the Walmart building gets associated with all the stimuli. Okay, so that's the pairing there. Then the person realizes, man, when I'm coming up to Walmart, I'm starting to sweat, breathe hard. I'm thinking I don't want to go in there, and I'm running away. Oh yeah, really scary, Jo. So yeah, who knows? There could be dogs in the parking lot. Lots of intense stimuli in Walmart. Okay, so you've got this person having a lot of anxiety in the Walmart parking lot. Then they do an avoidance response. They run away from their parent and they run back to their car and get back in their car. And when they run away and get back to their car, they start to feel better. Their heart rate returns to normal. They're not thinking scared thoughts. And they're not, they're not feeling like aggressing. They're relieved. So that means that running away just got reinforced. I was trying to go to Walmart. I couldn't. I ran back to my car. Woo, now I feel better. So over time, avoidance and running away gets reinforced by relaxation. Does that make sense? So let's say if what you're scared of is being separated from your mom, you try to get on the school bus, you feel so scared, and then you run off the school bus back into your mom's arms, and then you feel relaxed. As that happens again and again and again, that avoidance behavior has gotten reinforced. You're running away and running back to your parent has gotten reinforced with relief. So over time, you're likely to run away again. Why wouldn't you? Because you've been taught that that's what results in the good feeling. Does that make some sense? Yeah, I mean, Jo just did it. She ran away. That's what humans do. But if you do that enough, I mean, I don't think Jo is a person that avoids everything, but it might be that if you have a person that's sensitive enough and they avoid and run away enough, if Jo, encounters that barking dog in Walmart frequently enough, she might start to avoid Walmart. She might start to avoid all kinds of things because avoiding is relaxing and relaxing feels good. Does that make some amount of sense, guys? A little bit? Let's see what I have next. I think I'm almost done with my part, Tara. Okay, so this is just some general things about interventions with anxiety. Use of contingencies and visual structure as an antecedent so we know what to expect. So if Joe is afraid of going into Walmart, if I tell her ahead of time, this is what aisle we're going, or maybe I show her a picture or I use words if she can understand words. Joe, this is what aisle we're going in. I'll go ahead and check and make sure there are no dogs in there. You're going in to buy dishwashing detergent. Here's a picture of it. And we're going to be in there for about 15 minutes. I'll set the timer. So this is how we might help somebody face their fear, by helping them out with a very structured plan for what they're trying. Yeah, exactly. There won't always be a dog, thank goodness. But you maybe want to have somebody go and check next time, you know. So coming up with a plan to make it more tolerable, using mindfulness or relaxation stuff to decrease your subterranean river of anxiety so it's lower. We're going to practice that, I think, while we're in here today, and you're going to learn about some other strategies too. Professionally, you know, these strategies on the bottom are strategies that you would need a helping professional to get you through, probably a psychologist, maybe a psychiatrist. The British like to do flooding. So they would take Joe, poor Joe, and put her in Walmart and make her stay there all day until she relaxed. Americans don't usually like to try flooding strategies. Americans prefer systematic desensitization, where you face your fears just a little bit at a time. And you might start by practicing relaxation and even imagine yourself walking into Walmart or walking onto a plane. Oh my goodness. So here's Brooke Maupin. I was just talking to you about our former student who's been flying all over Alaska doing good work. She's just waking up and saying, what time is it at your time, Brooke? Let's see if she can tell us. It may take her a minute to get it to tell us on Facebook. This is pretty cool. This might be ASBG's first audience member coming in from Alaska, right? So modeling, we've already talked about modeling. So, you know, Joe, if I was working with Joe, I might show her, look, this is how I'm going to take a deep breath and walk into Walmart. I'm going to give myself a butterfly hug to help myself handle it. Self-management might be rewarding yourself for doing it. If Joe had a goal of shopping in Walmart, she might say to herself, oh gosh, I don't know what Joe would really like. She's like, I'll get a super big Starbucks drink for myself inside Walmart if I'm able to go in and do my grocery shopping. Yeah, we're going to talk about, we'll talk about mindfulness a little bit later in our talk today. Exposure and response prevention can be pretty tough to manage as a parent. You need help with this, but I actually worked with a client with this who was afraid of puppies and dogs. So for him, I started with the very smallest puppy I could find. I think it was about a 3-day-old puppy. It couldn't move, it couldn't do anything. And I brought it into his house and I said, okay, I know you're going to want to run away and hit me when you see this puppy, but this is a safe puppy. And I'm going to keep it in this room with you right here until you relax and feel better and feel safe. So that would be exposure and response prevention. I didn't let him run away. I brought in a very unobtrusive little puppy, and we just stayed in there and talked about calming things until his blood pressure went down and his breathing slowed. And that helps him get his relaxation reinforcement in the presence of a puppy rather than running away from the puppy. Cognitive behavioral therapy involves changing your thoughts so that you reduce your anxious thoughts and you change them to a version that's more helpful for you. Oh, thank you, Joe. So Brooke has just gotten up early. So let me do some CBT on myself. I do it when I go to the dentist all the time. So my first thought would be, I hate dentists. This is going to hurt. I'm so scared and unhappy. I hope my dentist is not here right now. I hope he doesn't see it on Facebook Live. So these are my natural thoughts, okay? I hate dentists. This is going to hurt. I hate being here. I don't want to be at the dentist. So if I'm going to do cognitive behavior therapy and change my thoughts, can one of my students help me? So I'm stuck in the moment. These are the only thoughts I can think. Can one of my students type in the chat box and tell me some different thoughts I might try to think, and then I'll read them out. And while my student is typing, I'll say here at the bottom, you can use any of these therapies together to get an extra good and quick response. You can teach the individual you're working with about these things and try the things that work best for them. Let's see if anybody has some good replacement thoughts for me. I really need this. Oh, this is great, JP. This may be hard, but getting my teeth checked on is a healthy way to make sure I keep my teeth. I do want to keep my teeth. That's good, JP. That's really good. So that's teaching me why it's important for me to stay in the dentist chair. And I would also, this is what I really do say to myself when I'm in the dentist chair. I do this every single time I go to the dentist. I can do this. I can stay calm. Ooh, Kristen says, I'm scared of the dentist, but I'm tough. I've been to the dentist before and everything was fine. It's good to have healthy teeth. I also say to myself, I can breathe. 1, 2, 3. I do that, and my dentist is probably wondering why my breath sounds so funny, but I don't care. I need to do my breathing. I especially don't like getting a shot in my mouth. And when I have to do that, I really have to I do my breathing. So I'm bringing out my mindfulness, my breathing, and I'm bringing out everything I can say to myself that's calming. I don't know how I would ever go to the dentist if I wasn't a psychologist and I hadn't learned to change my thinking. I probably would be running away. And then my avoidance would get reinforced through relaxation and I would run away again and again. And by the way, I want everybody to reinforce me. I've got an appointment to have my teeth cleaned for the first time in a year next week. Tell me good job. Ooh, and so Sarah does some biological things. When she has to get her blood drawn, I don't like that either, Sarah. She has some little treats for herself to help her tummy feel good. She doesn't look at the blood draw. Great strategies. Hi, Shirley Smith. All right. What's my next slide? What else do I have to talk about? Oh, okay. Here's my bottom line. One of these days, I'm going to get this on a shirt. Facing fears fights fears. Fleeing fears feeds fears. So if you gently encourage yourself to face the thing you're scared of course, very gently, then you'll over time become less scared of it. If you avoid the thing you're afraid of, then that's going to make that fear stronger. So if you're going to screenshot anything in this talk, here's what you should screenshot. Facing fears fights fears. And that doesn't mean you have to face it in an upsetting or difficult way. You can take your time. Fleeing fears feeds fears. All right, is that the end of my slides, Tara? So, okay, one more. I just can't hush, can I? When you're trying to figure out how to help yourself with your anxiety, it's good to understand the nature of your anxiety and what's driving it. It's good to understand what's going to work for your family and what's ethical and feels safe to everybody. Ooh, Joe did it. Joe faced her fears. So she used to be afraid of blood draws, but she donated plasma for a while. And as she did it again and again and again, she's no longer scared. Perfect, Joe. You know what? I used to be scared of talking in front of people. And of course, after being a teacher for, I don't know how long, however long, 25 years, I can just make a fool of myself anytime and I'm no longer scared of it because I've said foolish things so often that they no longer make me anxious. And of course, you want to take particular notice of characteristics of the person with anxiety because developmental differences can impact the presentation of anxiety. Okay, what's next? I'm going to try to get myself to keep going. Of course, people with autism and intellectual disability can feel anxious, right? Because they're people. So they can feel any of the things that anybody can feel. But if you have difficulty talking about your fear or identifying it, knowing what you're experiencing, then you might show your anxiety with challenging behaviors. So you have to understand autism deeply to be able to help people with autism with their anxieties. And you have to know the specific person with anxiety as well as possible. Just some other considerations, you might often ask yourself, is this anxiety or is it a sensory sensitivity? Or is it a sensory sensitivity that's kind of created anxiety? You got to watch for that. Because of course, if somebody has an intense sensory sensitivity, you want to be very careful about helping them face that, right? because you don't want to overwhelm them. And you want to, so if I was treating a neurotypical person for a fear of Walmart, I probably wouldn't think about sensory sensitivity as much. But if I was treating somebody with autism who's scared of going into Walmart, I'm going to be aware that somebody with autism can be extra sensitive. So I'm going to realize, wow, would you want a special hugging coat when you go into Walmart? Would you want to wear noise canceling headphones or earplugs when you go into Walmart? Would it help you to wear sunglasses when you go into Walmart, right? Just knowing about possible sensory sensitivities in autism might help us make some accommodations for certain situations to accommodate sensory sensitivities. Ooh, so Kelsey's pointing out that her feet feel real tickly when she feels anxious. So, who knows? She might discover that certain kinds of socks are comfortable, Yeah, Mary, so, it could be sensory, it could be anxiety, and you can try to treat both. You can make accommodations for sensory stuff. You can try to find things, stimuli that are relaxing. Another question you might have, is this an anxiety response or is it a social communication challenge? Um, you know, so we can make sure that the person understands a particular social scenario that they might be displaying challenging behavior in. This is what we're going to do in this social scenario. So that way we know they're informed. This is how you can use, an augmentative device or a little card. Maybe you're too nervous to talk in this situation, but you can hold up a communication card to order your McDonald's hamburger, or whatever it is you're trying to do. So just knowing that social communication can be a challenge and giving people some tools to use so that they can participate even if they feel anxious. With these Zoom groups we've been doing lately, we've had some people that felt really anxious about participating on Zoom or showing their image on Zoom. And so that's an easy one. It's like, well, you don't have to show your image then. Why don't you just participate by voice? Or maybe you don't want to participate by voice and you want to participate in the chat box instead. Oh, somebody's pointing out, yeah, that some people with autism, some neurotypical people too, can be afraid of toilets because auto flushing is so startling. So actually one of my daughters, I used to always have to go in and put something over the auto flush, over the little eye on the auto flush thing, because otherwise she'd be scared to sit on the toilet. So we can take away that sensory aspect to using the potty. So they're more likely to use potties. One thing I learned with her is that potties at Disneyland are all auto flush. So we had to go in with a little handkerchief and cover the auto flush eye so she could use the potty at Disney World. And actually one of the times that we went, she was 2 and we were all very tired. So we just said, oh, guess what? You get to pee in a pull-up this time while we're at Disney World. We can't handle the auto flush toilets. Then the second time I was prepared with a handkerchief so I could cover the auto flush, and I would show her the handkerchief before we went into the potty. So luckily I was a psychologist and I was able to figure out a way to have a toilet fear and still have fun at Disney. What else do we, oh, well, what outcome does the person want? Yeah, this is everything. So this is my last comment. We want to check the person's level of understanding of the program, what we're doing. And we want to say, what does the person want? What does the person need to do? Maybe the person just says, I'm not going to fly in a plane. I'm really frightened of that. Okay. But maybe the person says, well, my family really wants me to be able to go to Disney with them. So I've got to face my fear of auto flush toilets so I can go to the bathroom while I'm at Disney. How am I going to do that? Oh yeah, Post-it. It's a great idea. I used a handkerchief, but a Post-it is a great idea. So, the great thing about a group like Autism Society of the Bluegrass is if your child has a particular kind of anxiety or fear, you might be able to post on that and get some great ideas, like this idea for auto flush toilets. Oh, this is a great, so Greg says that he has a family member that used to be afraid of toilets, and Greg, he helped this person face his fear by spending some time with the toilet and looking inside the toilet and seeing the engineering in the toilet. Greg, you didn't know you were doing this. You knew you were giving an explanation for how the toilet worked, but what you were also doing accidentally is helping your family member spend some extra time with the toilet. So he was learning not to avoid it, but to be able to relax and get interested in the toilet. You helped him face his fear to fight his fear. That's really cool. Very cool. All right. Now I think it's finally time for me to hush. And I've got a student who's going to talk about some helpful hints for using visual structure and supports to live with anxiety. Come on up.
All right. So I'm really excited to present on this. I am personally a very visual person. I learned that way. I use a lot of visual supports myself, and you might find that you do as well as we talk about these, or that you know someone who does, or that you've seen them a lot more than maybe you like consciously realized. So I'm excited and thankful to present on this part. So, change, which can come from a variety of things in everyday life, and also changes in specifically routines, can be a common trigger for anxiety for everyone, but also for individuals with autism spectrum disorder. And this can become even more complicated to manage. The anxiety can be more complicated. The changes can be more complicated just with increasing age. So, one of the things that you can incorporate to address it or even maybe prevent the anxiety are visual supports, schedules, just visual structures. These can be really helpful in helping someone kind of focus in and maintain attention on that thing. It can focus in on a message and really get that message clearly across to someone. It can help make abstract concepts more concrete, and it also can be really helpful in expressing thoughts. There are other benefits, of course, too, but all of this can come together to help decrease anxiety. And as I mentioned, they're commonly used anyway. So that makes them a little bit easier as well, I think, to kind of add them in. They can be super helpful with transitions, a variety of things with managing or setting up routines, scheduling, self-care activities, everyday life, kind of independent living activities, just any of these things. They're very adaptive. And though they're easiest to use kind of in a setting that has a set schedule already, they can be adapted for other settings. So that is really great because we always talk about having, comprehensive care and having it in multiple settings. So if a child uses a visual support at school, for example, it's super helpful, then there's likely a way that it could be adapted if it needs to be adapted to be used at home so that when the child is in all of their settings that they're typically in every week, that they spend a lot of time in, they have the same support across multiple settings. And I do pose a question to everyone. You can raise your hand if you want, you can chat if you want, or just think about it yourself. How many people have a planner, a to-do list, a calendar, something like that, they use every single week to kind of look at what they're doing so they know what to expect? Yep, I see comments. So JP does, Kristen does. Dr. Bundy can't function without hers. Oh, Lori said a calendar and a to-do list. I know I have my planner next to me. It's as big as my laptop, y'all. It it keeps me going. Let's see. So thinking about that, when I was thinking about it, at least, I was like, oh my gosh, yes, I already use a visual support. Those are all examples of visual supports we're using. And if you think about it, imagine what you might feel if you didn't have it, if you weren't able to access that planner, or you weren't able to access your computer calendar or your to-do lists. I don't know about y'all, but I would feel pretty anxious. I would not know exactly what was happening every day, and not knowing what to expect, not seeing it visually, that would give me anxiety. So it makes sense that, these kind of supports can help address anxiety. So here I have a few examples of what a visual structure is. There's tons of them, but here's a few. So, and you all have mentioned a bunch of great ones as well. Oh, there's a poll, so we'll get numbers on how many people use a planner or something similar. You can also have a step-by-step guide for how to do things, daily schedules, monthly schedules, anything like that. They can use pictures, words, a combination of both, labels. There are tons of things. So here I want to focus in on labels and locators. Some of these we might be more familiar with. These were a couple that I wanted to focus in because they might not be as commonly seen as something like a calendar that already comes on our laptop and things like that. So a label is used for organization and identification. And I know when I first think of labels, I picture the labels on like filing cabinets. And that is an example of one, but there's other ways to use labels. So if you want to label a drawer where something goes, for example, spoons, paintbrushes, anything where a child might get anxiety about where do I put this? You can just put a little label on there. It could be words, it could be a picture, whatever, whatever's helpful for that person. You can also just use pictures to show that it is, like they can identify that that is their area. So I've seen this a lot with schools. Teachers will take pictures of the kids' faces and print them out and put them on places. So when the child has their bag and their coat and they're like, where do I put this? What do I do? They can just find their picture and be like, this is my area. This is where my coat goes. This is where my bag goes. And it can kind of alleviate some of that stress. Ooh, yes. Sandra on Facebook said they have calendars and schedules everywhere. Same. I do that too. And then for locators, these are helpful in location and where someone is, where they will be, something like that. So for example, you could have kind of a home picture and a work picture and have mom's picture. And then like when mom goes to work, mom's picture goes to the work symbol. And when mom is coming back home, mom's picture gets moved. It can help reduce anxiety about guests as well. And I have an example of this. And then it can also be used for things like where someone will be. So say, for example, you have two parents with shared custody. A child could have a visual that shows, okay, on the first week of the month, blah, blah will be at mom's house. And there's a little picture of mom and a house. And then, okay, on the second week, blah, blah's here. And you can move the picture back and forth to show where they will be, whose house, mom or dad's. You can go ahead, Sarah. So I have a bunch of examples of different kind of schedules and calendars and supports. Oh, 100% of people said they have a planner or something similar. Yes, so you can see how often we all use these. So for this example, this is a little calendar. This would be more useful for looking at the big picture instead of little minute details. So if you want to know, oh, it's Monday, I have school today. Will I have school the rest of the week? What about next week? You can just look at this and look at the pictures, look at the words, use both, whatever is helpful for you. Here's a good example of a locator. So if someone's coming over, you could have a picture of them or some sort of like cartoon drawing or whatever will identify that person best. And so if grandma's coming, if someone from out of state is coming, if a friend is coming over, you can just put their picture right there on that square and they know, oh, there's home. They're coming for a visit. You can also have visual schedules and routines. These can be as complex or simple as needed or wanted. They can be broken down by different times. So if you want it by day, by week, by month, whatever works. That is a good question. If anyone knows more about kind of what sort of visual things can be added for people who are blind, I'm not as familiar with that, honestly, but there might be some out there. And you can just adapt it. So if someone is overstimulated by certain components of visuals, you could adapt it to use something else. I talk about color coding later, but that's an example. Maybe that would be more helpful than having a bunch of words and labels.
Sometimes, now with phones, people do, little alerts. They might do a little alert on a smart watch or on their phone that says, it's time to change classes or bathroom break. So, ooh, that's cool. Yeah. So if the person has some vision, you could use some visual things. But I like the way Dr. Forsyth is pointing out that we might have to use audio cues to orient people and to sort of help them know what to expect if it's a person that can't see. Great feedback.
Yes, and for anyone on Facebook, just in case you all can't see the chat, Joe mentioned something really cool too. Her friend is legally blind and she uses bright tape on light switches, keyholes, things like that to make her be able to see them better. So thank you for sharing that, Joe and Dr. Bundy. And so any routine can be broken down here. We're going to have a bunch of examples of different kinds of routines. It could be very complex. It could be one activity you've broken down into little pieces. It could also be like a whole morning routine or a whole day routine that you're breaking down. They can be super helpful in transition anxiety as well. So having an idea of what's coming, what to expect, and having lots of like alerts or prompts so that it's not as sudden. So it can be really helpful in targeting some of the really stressors that come with transition moments. So here you'll see this is kind of that whole routine bit. So this would be a whole morning routine, step by step. What are you going to do from the minute you wake up until you're getting on the bus? Here's a visual schedule for different times in the day and different days of the week. So you could have like what activities they will do or you will do every morning, afternoon, evening on different days. Here's another calendar one, and this kind of setup is quite common, at least with what I've seen, where you have little like things you can stick, whether it be stickers or a lot of time the Velcro, so you can like reuse pieces. And then here's one that has a specific activity broken down. So the step-by-step order of brushing your teeth, and you could do these with any kind of activity that you wanted to do them. And then here is kind of what we were talking about earlier. I know I use both of these all the time. I make little notes on my laptop like this of like to do or what I'm going to do in order for my day. There's the calendar app over there that probably resembles a lot of our planners. So there's some kind of written text versions as well. There are also social stories that can help reduce anxiety. So these are stories, as they sound, that can help with anxiety-inducing situations. You can go through them and it can help remind that person of the coping strategies that they can use at that time, kind of describe what that situation will look like so it can let them know this is what I can expect. And it helps them prepare to know how to handle it. And what's great about these is you can bring in interests that people have. So I've seen superhero ones, dinosaurs, D&D. I created a D&D one. So it could be anything someone is interested in. So here is an example of one. Here's a little social narrative of some things that you could try when you want to play with your friends. And it has little illustrations as well that you can go through as you're reading it. And these, I should know, are not necessarily something that you like read once and you just forget it. These are things that you can keep and you read and you refer to and you think back of or back to as often as needed, especially if the activity is something that happens quite frequently. So here you see a few more examples. Some of these have like emotions, people that might be involved, things like that. And then here is, you can see like a quite detailed one. So you can make it as detailed or as simple as you want. So this one talks about social networking safety. And then the last thing I want to take note of are a few additional notes. So like I mentioned, color coding can be super helpful. I mean, if you think about it, we've been talking about identification and organization, and that's exactly what color coding would do. Just another option that could be super helpful to add or replace something, like if you don't want labels. And technology has been super helpful in making these. Even pre-pandemic, I was using a computer to make these when I needed them for therapy and things like that. And now I am able to kind of share my screen with someone and we make them together. It's helpful in finding images and you can just print them out, print as many copies as you need. So if your original gets wrecked, it's okay. You can just print more. Anyone can do this and they can be made for anyone with any age, any ability. You can kind of adapt them and anyone can make them. And there's no pressure to have this specific template or anything like that. There's really great free resources all over. Pinterest is actually a great place to find some. We found some of these examples from Pinterest, and they have great printable pages, great templates as well.
Hey everyone, so I'm going to talk to you a little bit about systematic desensitization now. And I'm going to give you just a brief overview. This is a treatment that's empirically based and that can be done to help an individual with autism or without autism who is experiencing problems because of a phobia that they have. And I know we talked a little bit about phobias earlier. You guys gave us some great examples, so I might refer back to those as we're going through. But just to start off, systematic desensitization was created by Joseph Walp, a behaviorist who created this in the 1950s. And since that time, a lot of research has been done and it's been demonstrated to be effective at treating phobias. So we could call this procedure, if we were to break it down, a counter conditioning procedure. And I know Dr. Bundy talked a little bit about conditioning earlier. So just to review that, what we would be doing with systematic desensitization is trying to replace a maladaptive association with a certain stimuli. So whatever the person is phobic of, replacing that with a more adaptive response. And so when we're thinking about phobias, what do we tend to feel? We're exposed to something we're phobic of, like, I don't know, for me, it might be a snake. I'm terrified of snakes. What am I going to react like? Crickets?
Scream, run.
Right. Scream, run, and what feeling am I experiencing? What emotion? Fear, anxiety, hard to breathe, fear. Yes, I love it. That's right. Yeah. So when we're talking about systematic desensitization, we're trying to treat that anxious response that a person has when they come in contact with the stimuli that they are phobic of. So it works by pairing relaxation strategies with imagined scenes of anxiety-provoking situations. So situations where the individual is being exposed to their phobia. And over time, as we do that more and more, we increase the frequency and the duration of exposure to that anxiety-provoking stimuli. In addition to using these relaxation strategies, that anxiety response decreases, and we see the relaxation piece increase instead. Let's see, so Tara, if you'll go to the next slide. Thank you. So there are some important considerations to think about whenever we're deciding if we're going to use systematic desensitization or if it's right for our family member or right for us. So research has shown that this treatment is less effective if a person suffers from several phobias. So as the amount of phobias goes up, the effectiveness of this treatment goes down. So that's something that we would be considering when determining whether or not to use this treatment. Additionally, we need to be aware of whether or not the client's fear or phobia is reflective of a major skill deficit. And so one example that I like to think of when I'm talking about this is like test anxiety, right? So we have, let's say, a kid who is going to take a test, and every time they are prompted to complete a test, we notice that there are some behaviors indicating that they're anxious to us. And maybe our first thought is, ooh, I need to desensitize them to test taking. But we've got to back away from the situation for a moment and consider whether or not they're truly just anxious about taking the test, or are they anxious about maybe the scholastic concept that's being presented to them. So are they really struggling with math? Are they having a hard time with reading skills? Because if so, then systematically desensitizing them to test taking alone is not going to be super effective, right? We need to target that deficit with the skill that's causing them the actual anxiety. Also, it's important to remember that desensitization is more effective when it's being used to treat a specific or simple phobia, right? So Dr. Bundy kind of touched on those earlier. That makes me think of like one single stimuli. Let's see from Joe. Okay. Will we be able to get the presentation after the meeting? I'll let Dr. Bundy answer that, sorry. But anyway, so desensitization is more effective whenever it's being used to treat simple or specific phobias rather than more complex phobias, or like I mentioned before, someone who has several phobias. Also, systematic desensitization is something that should be implemented by a psychologist or another trained mental health professional. Today, we're talking a lot about strategies that would be simple to implement in the home for a parent or a caregiver, or even for our own selves. But when we're using systematic desensitization, it's important to have a trained mental health professional guiding us along the way. Tara, if you'll go to the next slide. Okay. So, some more considerations when we're determining whether or not this is the treatment we'll use. The therapist or the mental health professional needs to ensure that desensitization will not cause sensory overload for the client. I know we've talked a lot about sensory issues so far. When we're working with this population, it certainly is of top priority to remember. It's also important to check for the client's understanding of systematic desensitization. So, if we're feeling like maybe the client is confused about any of the things that we're presenting, it's certainly time to regroup, right? Because the treatment's not going to be effective if we can't get the client to understand. But it's important to recognize that alterations can be made to the procedures in this treatment to increase the client's understanding. So Gabby just gave us a fantastic presentation on the ways that visual cues and visual supports can really help individuals with autism. And this is another area where those can come into play. So if language is difficult for the person we're trying to implement this procedure with, then perhaps we can support their understanding with some visual cues. I think you can all see this cute little image of the guy relaxing, right? And so here we've got the word paired with the image. And that can help to cue the individual, okay, it's time for me to sit back and engage in whatever my relaxation strategy is that my therapist has taught me. So systematic desensitization can really be broken down into these three big parts. And like I said, I'm just giving a brief overview of this treatment today. So I'm going to give you kind of a snapshot of each of those three parts, okay? So the first is training and relaxation. Relaxation is key to this treatment, right? Because it's the response that we're trying to replace for the maladaptive response of that intense anxiety when we come in contact with what we're phobic of or afraid of. So we need the client to demonstrate the ability to relax before continuing the process. We've got to be able to see that that's something they can do because it is a key component of this treatment. So over time, while we're implementing this treatment, the client will be prompted to practice relaxation in increasingly less desirable situations. And most commonly, the relaxation strategy that's used in this treatment is called progressive muscle relaxation. I know another one of our presenters is going to describe that in depth, so I won't get too into it because I know they've got some really good information. But just to kind of touch back on what I mentioned before about making some alterations to help individuals with autism engage in this treatment and understand. Again, this is another place where we can use visual support. So I know you guys can see this cute little graphic here demonstrating the different parts of the body that we would, for progressive muscle relaxation, tense, then release. Another thing that I found helpful in therapy when I'm doing progressive muscle relaxation is to prompt someone to practice with actually, can you guys see this little, it's a brain stress ball that I'm holding. But prompting someone to actually have a concrete example. So holding this in their hand and squeezing that, feeling what that feels like, and prompting them to imitate that with the different parts of their body one at a time. Sometimes we'll say things like, pretend you're squeezing lemons. And again, that's just to make what we're trying to do a bit more engaging and concrete. Okay, so part 2 is constructing an anxiety hierarchy. So the hierarchy is really important to this treatment. This is where we get the client to describe for us some different situations that involve their phobia that cause significant anxiety. And we're going to go on a level here. So you can see, I used the example of interacting with a dog. I think Dr. Bundy talked about that a little bit earlier too. So you can see we're going up the scale here with our fear rating, right? So thinking about a dog, that might be something that causes this person a lower level of anxiety, whereas going all the way up the chart to petting a dog causes a much more intense feeling of anxiety. And so we start constructing this hierarchy early on in the treatment. We can start it at the same time that we're teaching the client to learn relaxation skills. And this is something that the therapist and client do together. The scenes that they determine need to depict realistic, concrete situations that are relevant to the client's fear, right? So if the person is has a phobia of snakes, then their fear hierarchy is not going to be about dogs, right? It'll be about snakes or whatever it is that they're afraid of. I think someone mentioned earlier that their child, we had to talk about being afraid of the toilets, right? So the scenes need to depict realistic, concrete situations that match their fear. And it's important to note that the primary responsibility for generating the items in the hierarchy belongs to the client. So the therapist is there to support this and kind of give the client some structure as they're going through creating their hierarchy, but we need to remember that the client is the person who's experiencing that anxiety. So it's kind of like they're their own expert in this sense, right? They're going to be able to tell us best which situations would cause them greater or less anxiety. And so then step 3, the final step, is where we bring these two things together. We bring the relaxation and the hierarchy scenes together. So the client here is, Dr. Bundy says, if they can't communicate their fear ratings easily, the family might be able to help based on observation. Yes, that's definitely true. So collaborating with others who are around the person with this fear very often would be key here. And I think we find that in the autism community very frequently, right? That collaborating with caregivers is super helpful and important. So the client in this stage will begin the desensitization procedure. They're asked to imagine a scene from their hierarchy as clearly as they can, and we would start with the lowest level of anxiety, the situation that causes the least anxiety, right? So in my example before, maybe it was just seeing a dog from a few yards away or whatever it was. And once they're imagining that scene and begin to experience some symptoms of anxiety, they cue to their therapist that they're starting to feel anxious. They can do this by holding up a finger. And the therapist prompts them to implement their relaxation strategy at that time. And additionally, this procedure will be repeated for the entirety of the hierarchy. So we repeat this over and over and over again until we've paired a new response with the thing that the person has a phobia of, right? So I know Dr. Bundy and some others talked about pairing earlier, and that's essentially what we're doing here. We're trying to pair this relaxed, calm feeling with that stimuli that once or initially caused the person such intense anxiety. See, Joe says, yes, because with ASD, you often get those who are nonverbal, minimally verbal, or selective mutism. Yeah, Joe, that's such a good point. It is super important to talk with the caregivers, I think. And again, that brings up my point earlier about making adaptations, right? So we have to meet these clients wherever they are. And if they are minimally verbal, then it's another area where using visuals and collaborating with family members is key, right? And I think that's it for me. Tara, will you click? Yeah.
Okay, so now we're going to talk about relaxation techniques. So what exactly is relaxation and why are we doing it? So when you're in a relaxed state, it's a state of being free from tension and free from anxiety. And some of the reasons why we do this is because maybe we're stressed, we're frustrated, maybe we're overwhelmed with everything that's going on at work or with school in some of our cases, and we're trying to relax so we can get back to that baseline feeling of being free from tension and free from anxiety. And some of you may be thinking, well, can relaxation look different with ASD? And it definitely can. And I have a couple of examples of things that we can do for our individuals who have ASD. So there are many different ways to relax. Sometimes it's automatic and what I mean by this is that we just automatically relax. Some things that we do, like after a hard day at class, sometimes I just pop back with a book, and that's how I'm automatically relaxing. But other times we have to prompt ourselves to relax. Like we have to think, okay, I had a really stressful day, I'm really feeling it, so I need to do such and such to help me relax. But there's 3 different ways that we're going to talk about today. We're going to talk about mindfulness, grounding, and progressive muscle relaxation, or PMR. So mindfulness, it's consciously being aware of something. You're focusing awareness on the present moment while also acknowledging and accepting one's feelings, thoughts, and bodily sensations. So there's different ways that you can do mindfulness. You can do it yourself. You can do an app. There's several apps that we're going to talk about that can help you with mindfulness. And you can also follow a script that will help you with mindfulness. So some mindfulness tips. Just keep it simple. The purpose of it is for you to relax. So the simpler it is, the easier it is going to be for you to relax. You can customize your meditations. So there's a lot of different meditations out there, and you want to make sure that you're using ones that you like. You're not going to be able to relax if you're doing a meditation that's probably not something that you're interested in. You also want to create a ritual. So do it at the same time every day. Do about the same thing so you have it constant. You know what to expect when you're going to do it. And then also you really have to practice mindfulness. It's like any other skill that we have, you have to practice it in order to really start feeling the helpfulness that mindfulness can bring. For kids to practice mindfulness, you can get a breathing buddy. And breathing buddies can be something like those dolls that are in the picture right there. And they're just something that you put on the child's belly, and you have them lay down while they're doing it, and their breathing buddy is on their belly. And it shows the kids that breathing is something that's within their control because their breathing buddy goes up and down as their belly does. Additionally, you can be mindful with your kids. So kind of going back to modeling. So if you're modeling mindfulness activities and behaviors, your child is going to see that. And they're also going to start, showing those mindfulness ways that you do. And then also just have fun with it. You want to relax. So you definitely want to have fun with it. Yeah, breathing buddies can be for kids, but I think adults could use it too. Because look at that turtle on that middle kid. That turtle is super cute. I would love to have a breathing buddy who was a turtle. Okay. So this is one of the scripts I was talking about, and I believe this was created by one of our students who's currently on internship. I think Sarah Critchfield created it. And if you can see on the side here, there's a bunch of different scripts to go by. So the one that's on the screen is if you choose the space station door, but then there's also skunks and trains. So really you can find scripts that are more specific to what your interests are or what your child's interests are to help them really get into the script and start feeling the benefits of doing mindfulness. So these are some of the apps this is one of the apps that I was talking about, Stop, Breathe, and Think. And I do believe it is free for download. And Tara, if you'll hit play, thank you. So one of the things I like about this app is that you do a check-in, and you're telling the app how you feel physically, how you're going to feel mentally, what are some emotions that you're feeling, and there's a bunch of different emotions that you could be feeling, and then you just select some of the emotions that you're feeling. So this person is feeling neutral, they're feeling mixed up right now. Let's see. They're not confident, and they're feeling a little self-critical. So then you see results, and the app is going to calculate your results, and it's going to tell you what are some things that it recommends that you do. So this person, relax, ground, and clear, and then there was a gratitude meditation, I believe. So I think that's just a really cool app that you can download on your phone. And then we have some more apps on the next slide. So the Calming Bottle, Calm, Pacifica, and Mindful Powers. I really like the Calming Bottle. I think it is, I think kids would like it too. I think it's for kids, but I find it really relaxing because you can add the colors, you can add your own sparkles, and you can make it spin. I find it really relaxing because I like to make my Calming Bottle very, very pretty. But these are just some other apps that you can download on your phone for you and your child to use to help you practice mindfulness. So grounding is one of my favorites, actually. It's a mindfulness related practice based on being aware of the present moment through the 5 senses. And it is really helpful in managing your overwhelming feelings or intense anxiety, and it helps you regain focus from any intense emotional state. So again, much like mindfulness, you can do it yourself, and there's also apps that help you do grounding. So the 5, 4, 3, 2, 1 game. I do this one a lot when I am doing grounding, and I think we should probably do it all together if you guys don't mind. It's one of my favorite things to do. So what you're gonna do is I want you to close your eyes, and I want you to get really relaxed. take a couple of deep breaths. Now, what I want you to do is I want you to name 5 things that you can see. Maybe you're imagining yourself at the beach or someplace that you're really comfortable. And what are 5 things that you can see? Now, I want you to name 4 things that you can feel. What are 4 things that you can feel at that beach spot? I'm thinking I can feel the sand on my toes, maybe the breeze on my face, or the ocean mist. Now I want you to name 3 things that you can hear. Maybe you're hearing the waves crash against the sand. Maybe you're hearing some children play, or maybe there's even a dog barking because he's excited that he's visiting the ocean for the first time. And what are 2 things that you can smell? And finally, what is 1 thing you can taste? And if finding something you can taste is hard, name 1 good thing about yourself. And then when you're ready to come back, just come on back. But this activity is something that I really like doing. And if you're ever in a situation where you just don't have the time to find 5, 4, 3, 2, 1 things, you could shorten it. You could do 3 things and then 2 and then 1. And it could be really quick. You don't have to get super comfortable. You can do this in your car. Maybe don't close your eyes when you're in your car. You can do this when you're at work on a lunch break or something like that. Just anything that's going to anywhere that you're feeling super intense emotions and you need some grounding. And this app, Action for Asperger's, is another app that is more focused on grounding. Tara, can you hit the play button? And it is free to download. I know for sure because I downloaded it. But it tells you what is grounding. And then it gives you just a bunch of different examples of what it is. And then I think why we ground. And then there's some grounding exercises that the app also has for you and your family to try, like mental grounding and everything. So just a quick little example of what the app has for you. Terry, you can go ahead and pause it or go to the next slide. I didn't realize the video was so long. Okay, so the last one that I'm going to talk about is PMR, progressive muscle relaxation. And it was hit on a little bit earlier, but I'm just going to talk about it a little bit more in detail. But the purpose is to help release tension and notice how muscles feel when they're relaxed. So often when you have somebody who is struggling with anxiety or they're really stressed, they tend to clench their muscles throughout the day and they don't even notice that they're doing this. So they're really tense all day, but they don't notice it. But with PMR, you are learning to differentiate between the tense feeling and the relaxed feeling of your muscles. And then as you practice this, it can cue the relaxed feelings when anxious. So the 3 steps of it are to tense a particular muscle group, then release the tension, and then notice how it feels. So you're noticing the difference between the tense and relaxed muscle groups. And something really cool about PMR is that there are tons of YouTube videos that you could watch on YouTube, and it's somebody with a much more calming voice than I have, and they're just walking you through tensing your shoulder muscles, tensioning your fists and relaxing. There's 10-minute ones, there's 15-minute ones. But something else that's important to notice with PMR is not everybody likes to tense their muscles and relax. And the same thing goes with all these activities that I talked about, is maybe they're not all for you, but there's lots of different ways to relax. And I'm sure with, if you have any questions about how to find different ways to relax, if none of these work, your clinician or any of your friends might be able to help you find a better way to relax. And I think that might be it for me.
All right. So I'm going to talk a little bit about some other anxiety management strategies. And the first one being the incredible 5-point scale. So what is the 5-point scale? So it was created by Buren and Curtis, and it's a method for teaching social understanding to individuals with autism spectrum disorders and other similar challenges. So it's really unique in the way that it teaches social skills and emotion regulation by making it into simple and concrete constructs. So it provides this systematic way to kind of solve these behavioral problems, understand past and present, past and future social scenarios, and improve self-management. So it ultimately improves communication because it's giving them this concrete way to express the emotion that they're feeling, and in this case, anxiety. And it also can indicate severity. So it's very adaptable for different situations. So how does it work? So as you can see over here, we have 1 through 5 as our rating, and then we have the severity of the target concept, where it's starting out, it's non-existent, moving up in severity all the way to 5, which is very strong. So the scale can be applied to various concepts, including behaviors, emotions, and even specific situations. So once a target is chosen, it's separated into these 5 parts or 5 levels, and the levels defined by its size or its severity. And you want to avoid labeling them as, good or bad. You want them to be more specific than that. And so typically the concept is described at each level, and then you'll also have an additional column that is the actions you want to take depending on what severity you're at. So here's an example of one for anxiety. So looking at level 1, what does it feel like? You're feeling good. You're not nervous at all. So the action to take would be nothing. You're good. Now, if you move up a little bit and you're at a 2, you might be feeling a little nervous, but you're still okay. So you may want to, practice some deep breathing or try something relaxing. Moving up to a 3, this is where you're starting to get nervous enough that it's bothering you. So an action could be you might talk to a friend about it. You might keep taking those deep breaths. Moving up to a 4, this is where you begin to feel very nervous. You might need to remove yourself from the situation, maybe go for a walk or just keep taking those deep breaths. And then when you're up at the threshold at 5, this is where you're so nervous that you just can't deal with it. So you may need to find a safe person to help you. So here's some other examples of 5-point scales. So looking at the first one, this one shows like the anxiety curve. So that's where you're starting out at the bottom, you've moved up to 5, and then you're calming back down to ultimately get back down to 1. And you might just use your 5-point scale as a check-in just to see how you're feeling. So we have there, there's 1 through 5. It's got the faces to kind of show the severity of each feeling, how it's progressing. So you could just check in with, your client or your child, whoever you're caring for, and just be like, so how are you feeling today on this scale? And they could easily identify it and give you a number. And then looking at the one in the middle, this is where you can let them be in on creating the scale. So they can define what it feels like. And then they can also show you what it looks like for each level. And then this final one is one that me and one of my fellow classmates who's here today, Tyler, created for a particular client we have. This one happened to be for anger. And what I love about the 5-point scale is how you can personalize it to the individual. So this person loves Star Wars. So we used that special interest and we created this scale with them. They chose for each level what that's going to look like. So, down there at 1, where you're feeling calm, you're not angry. He said that was feeling like Obi-Wan Kenobi. Moving up at a 2, where you're starting to get annoyed, that's Anakin. Get to 3, you're starting to get angry, but you're still in control. And he was very specific. He's like, that's Luke, exactly when he finds out that Darth Vader's his father. Sorry for spoilers if you haven't watched it, but and then moving on up, he went to Darth Vader, and then ultimately at that threshold is Kylo Ren. And then you would also have other columns for those actions to take when you're feeling this particular way. And so here's the caregiver helper curve. So it's actually this curve down here at the bottom that's a little bit lower. So what's going on here for the anxiety curve for the individual, as you know, they're starting out at a 1, and this is where, you know, you have those positive relationships, they're built where you can teach skills and teach different skills for functioning in challenging situations. So you could use some of the things mentioned earlier, like the social stories or power cards, even some of those relaxation techniques. You'll have all those skills to be taught down here at level 1. When you move up to 2, this is those early signs of stress. Moving on up to 3, this is where you're starting to get that anxiety. 4, this is probably the time where, you know, it's getting more intense. And then 5 up at the top, this is the peak of anxiety. It's not really a time to talk or direct or problem solve. You got to get them down first. So going back down to 4, 3, 2, 1, where you can start using those skills again. And the importance of the caregiver curve down here is that you have to think about these things yourself, because when you have an individual who's experiencing that peak anxiety, that's going to raise your anxiety too. And you have to make sure that, you know, you're not leveling up with them, that you are able to remain calm in the situation to best help them come back down to a 1. So Dr. Bundy touched on this earlier. We do some social groups for individuals on the autism spectrum, and particularly one that we've been doing currently is a social group for teenagers on the spectrum. And so we encountered the challenge with the pandemic, like we really need to reach out to these kids and get that social interaction with them. So we adapted our group to a virtual format, which it was really rough at first, but then we kind of found this nice groove that really works for the groups. So we tend to do like a little short social skills lesson, and then we do a fun group activity. And we keep the lessons pretty short because we found out early on that if you do like a 30-minute lesson, you've lost their attention and they're just cameras off, they're ready to go. So we do like probably a 10 to 15-minute lesson, and then we spend the rest of the hour doing something fun. And this is where the anxiety comes in, because like Dr. Bundy said, Zoom can be intimidating. You get on and you can see everyone's faces on there at all times. But with Zoom, it's also easier to decrease that anxiety too, because you can turn off your camera. And with our activities, we always give the option of you can respond verbally to our questions or to our activity, or you can put your answer in the chat box. So we had a group meeting yesterday, so Friday. And what we did is we played a game kind of like this or that, and we'd be like, do you prefer this or that? Some of the kids would respond verbally, others would put it in the chat box. And then we always make sure some of our helpers are there in the chat box responding too, so they're still getting in on the interaction. And it just makes it really good for anxiety because the expectations are lowered. You don't have to be on that screen present the whole time, but yet you're still interacting with everyone else.
And so I'm going to be covering sensory strategies. So the quote is one size fits one. So we have this quote here, and it's co-regulate to help children navigate. So when we ask kids to do something which they might not have the skill set for, that's when our defensive brain becomes activated, and it happens in adults too. And so this is when we see meltdowns, anxiety, agitation, anger, and fear. And so this is when you want to step in and co-regulate with the child to help them find calm, and that way there's a happy ending to the story. And then this is a graph for the window of tolerance, trauma, anxiety related responses. So this yellow zone here is our comfort zone. It's our window of tolerance. In this state, we're calm, we're cool, collected, and we can emotionally regulate ourselves. And so the green box over here, these are things that cause us to go out of our comfort zone. So fear of control, feeling unsafe, fear of rejection, abandonment, trauma. These are things that push us out of our comfort zone. And so we can be pushed up into our fight or flight response. And this is when we're feeling anxiety, overwhelmed, outburst, anger, impulsivity. Or we can be pushed down into our freeze response. And this is when dissociation, shutting down, not present, disconnected, on autopilot, that's when that occurs. And so the goal is the orange box. So this is where we are practicing mindfulness. We're doing the grounding exercises, techniques for self-soothing, calming the body, deep breathing, things like that. And the goal of those is to keep us in our comfort zone. And the goal of this is to expand our window of tolerance with the practice of the mindfulness and the grounding exercises. Okay. And then we have the alert program. And so the alert program is similar to the 5-point scale. It provides us a concrete way to regulate our emotions, but it focuses on arousal levels. And so they use a metaphor of an engine. And so your engine either runs too fast, too slow, or just right. And the goal is to be just right in the middle, but we occasionally have engines that are constantly running too fast or engines that are constantly running too slow. So this is where we practice our grounding techniques to get us into that just right. And this allows us to notice the level of alertness in the moment, and then we can make our changes to get into that just right category. And so this is the meter example. So for example, you would have a kid point to where they're feeling. So if a kid is feeling too fast, you can bring in deep pressure, you can bring in a weighted blanket, you can have them go get a drink of water, take a break to get them back to just right. But if a kid's moving too slow, you can have them do 20 jumping jacks or go for a walk, do an animal walk, something that brings them up to just right so they're alert. An example for adults would be coffee. When we're running too slow, coffee brings us up to just right, that little bit of caffeine. Okay. And arousal relates to anxiety. So whenever we are high alert, we have high arousal, we have high anxiety. And so it's important to note that whenever someone says their engine is running too fast, check in to see if they're anxious, because they could be. And then I have videos that were on here. I'm not sure if we have time to go over them. I can play them if everyone wants them to. Dr. Bundy, what do you think?
Well, we started a little late. On the other hand, people may be ready for lunch. I mean, Sarah, how do you want to run it? I'm sure, of course, people can leave at any time. Is there one video in particular that you think might be useful? Of those, maybe choose one.
We can do this one. It's shorter and it kind of gives some examples of kids using it.
Okay.
I don't have a problem with continuing. Joe, if you know of a problem, you can say so, but I think we're good with continuing until you have finished whatever you want to present.
Okay.
If you're asking my opinion.
I don't have any issues with continuing. I figured we just would. And if people are hungry, hey, we're at our house. We can just go
Yeah.
eat.
That is true.
Yeah.
Okay.
Get a stuffy and take a rest. If your engine is too hot, go get a drink of water. Get a stuffy and take a rest. If your engine is too cold, you need to get some gas. Start your day with a get more sleep. If your engine is too cold, start your day with a snack. Make sure to get more sleep. If your engine is just right, you can race your car all day. It's okay to come last. If you're first, it's always not fair. When your engine is just right, it's easy to take turns. It also means you're ready to learn. If your engine is just right, you can race your car all day. It also means you're ready to
Okay. So bear with me while I try to get back to the PowerPoint. I think it messed it up. I'm glad that you liked it, Joe. I thought it was really cute too. Then we have grounding ideas and sensory diets. And when I first heard of sensory diets, I thought of food, but that is not the case. So sensory diets are a series of activities that help with regulation. It helps the children meet their sensory needs. And so when someone's engine is running too fast, you can use a sensory diet to help calm them from an overloaded state. Or if their engine is running too slow, you can have them use the sensory diet and it makes them feel more alert. So some different examples of a sensory diet could be for when their engine is running too slow. It could be jumping jacks, pushing up against a wall, yoga, animal walks. And then if their engine is running too fast, it could be a weighted blanket, deep pressure, things to calm them down. And using the senses is a great way to combat anxiety. And these grounding techniques can be used in addition to the 5-point scale or the alert program. And when someone identifies that they're feeling anxious, you can use the grounding techniques as a way to self-regulate. And these are some other ways to ground that focus on the senses. So we have exercise, weighted blankets, putting on lotion, taking a bath, chewing gum, getting something to drink, things that are focusing on your senses to help bring you into that just right state. So what are some strategies that you guys use? We've talked about a bunch today, so really it could be any of the strategies that were brought up. Joe says they have a sensory seeking room for Thatcher. That's awesome.
Well, I like to draw. That's something that I like to do to relax.
Okay. Any others that we either mentioned or maybe some that we didn't mention? Weighted blankets. I want a weighted blanket. Calming thoughts, knitting. Ooh, Gabby, that's a good one. A small trampoline. Yeah, so these are great examples that can bring us into that just right position. And then if you're looking for resources for a sensory diet, there's different, you can search sensory kits on Google. Pinterest always has great ideas for pretty much anything, honestly. And then we have questions. So I guess I'll stop sharing my screen for questions. That way we can all see each other.
Oh, chewing gum, that's great for your engine, because chewing gum can it can do whatever your engine needs, right? It can rev it up or it can calm it down. I love that example. Yeah, trampolines, fidgets. If you're in a situation like at work or right now, so I'm fidgeting with, I fidgeted with an eraser today just because I had it. So I can't jump on the trampoline while I give a talk, but I can fidget with an eraser. Good ideas.
I actually use, I actually bought a fidget toy for myself to use for anxiety, and it's like this slap bracelet. I think it's like over in a basket. No, sorry, the dog barked. He's not supposed to do that. No bark. There's somebody delivering us food. No,
Maybe
sorry.
it's all
Anyway, it's a bracelet. It goes around your wrist, and it's got these nubby things, and just hold on to it like that.
Joe, I was going to say maybe Saul wants to tell us about how he relaxes, because I've noticed a lot of pictures of him chilling out.
Oh yes. So Saul is great. He relaxes by laying down in the floor and tripping Thatcher.
Pets can be relaxing,
Oh, yes.
People with pets have longer lives, and people think it's partly related to exercise with pets, but it may also be related to the calming, blood pressure lowering effect of petting their fur and listening to their breathing. Yeah, exactly, Molly, listening to purring or breathing. One of my dogs snores, and I love to lay next to that sleeping dog and listen to the light snoring.
Yeah. My husband was having a lot of trouble, so he bought 3 gerbils. They're rodents.
So the gerbils relax Donnie?
Oh yes. He loves playing with them. He holds them every day. He loves it. And but they're rodents. So I'm not very
seem to be placing a value judgment on them, Joe.
Yeah, exactly, Joe. Sounds like the gerbils are not relaxing for you.
No, they're not, but that's okay because yeah, as long as he's doing okay, I'm like, yeah, I can deal with them because they're they're in an enclosure, they're in an aquarium. So
next, maybe Donnie will think that a boa constrictor would be really relaxing for him, and then you'll have some tough decisions to make.
The gerbils might place a value judgment on them.
yeah. I'll probably be getting a cat this summer though, so it's fine.
Are you gonna pit them against the gerbils?
Oh no. No, okay. I'm a cat person. I've always been a cat person. But the last cat I had was when I was pregnant with Thatcher, and she got sick and died. So.
Hey, so listen, guys, I'm noticing you guys actually modeling another form of anxiety management that we didn't talk about, which is social support, humor, hanging out with people that don't judge you and that you feel really comfortable with. So just as we might do that ourselves, right? I mean, our family members and friends with autism, and those of us who have autism, sometimes social situations give us anxiety, but certain specific social situations may lower our blood pressure and help us feel accepted and calm and good. So, we just have to maybe pay attention to that. In addition to social stress, where is the social situation that feels good? That's what we try to do with our autism teens. It's funny, you guys, because we had a guest at our teen autism group last night, and at the end he was saying, I was trying to figure out what your objectives were. And I was like, hanging out and being together and having fun. I said, we're just trying to be accepting and be able to be a place where people can act however they like and just be themselves. So I said, I guess that's my objective. I felt a little embarrassed about my objective, but I'm not going to change it. That is my objective for our social groups. We're not curing autism in there. We're hanging out and having fun together.
cannot be overvalued.
That's right.
I noticed someone in the chat asked how to sign up for the Friday social group. I didn't see an answer, and you probably have already signed up your group for now.
Yeah, we might have spots. Molly, if Molly will put her, she's the
Yeah,
guru.
I'll put my email in the chat.
Yeah, you can ask Molly and we can see if we have any spots. We have an adult group going too. It sounds like Fayette County has some great Parks and Rec stuff, but if you live outside of Fayette County and you're an adult who wants to hang out, I'll give we accept all kinds of different adults. So our abilities and our presentations are all kinds of different ways, but we've been having an amazing time in our adult groups too. We played Would You Rather in there. What else did we do yesterday in there?
Disney trivia.
Yeah, Disney trivia. I sing in there sometimes. If you want to hear me sing, go in there. If you don't want to hear me sing, you may want to have your noise canceling headphones ready.
So how many sessions in are you on that one?
We just started. We just did our first ones last week. So we're always happy to have anybody join, but there's certainly
Okay.
it's a great time to join now.
And then how many sessions are there? When does it end?
How many? 6?
There's
We usually do
6, so it
6
ends
a
on
set.
March 19th, I believe.
It's like
Okay,
high intensity interval training. We do a sprint of 6, and then we recover, and then we usually do another set. So it's ongoing.
okay. So people could contact you, Dr. Bundy, to sign up for that?
Yeah, or Tara can put her email in there. Yeah.
Okay,
I just put it in there for interest in adult social group.
great, thank you.
And Joe is just pointing out not only social interaction with somebody that you feel comfortable with, but sometimes you might need specific social support. Somebody might be telling us that it's lunchtime in there, Melanie. Do you have something to say, Melanie? Something to add? Melanie knows about a lot of resources.
Oh, I was just going to say, Dr. Bundy has a beautiful voice. Jay participated in the social group last night, and I'd never heard her sing, and she has a beautiful voice.
Was Jay holding his ears while I was singing?
No, he really enjoyed it. It was really, he really have a beautiful voice. It was fun to listen. I had no idea, so it was a pleasant, very pleasant surprise.
The only place I get to sing these days are usually in my social group. So you can see they serve a really important function for all of us, right?
Yes. Oh, that's great.
Thank
you for
guys.
this. This was an awesome presentation. Thank you so much for doing it. I loved it.
For setting it up. It was really super exciting. This is my first time being on Facebook Live, so that may or may not have gone to my head.
That's
I wanted to
wonderful.
bring out that we do have a social group that meets twice a month that ASBG
Yes.
also
Yes,
helps
yes.
pay for it. And Gabriella and Nicholas Hoffman, who's really Nick Hoffman, but they're our facilitators at that group. And we meet twice a month, and we are on Meetup, and we're pretty much try to keep it age 18 and older. But it's nice to have the, because it sounds like your group, Myra, is that more of a kind of like your 8-week class or something like that?
Yes, kind of similar. And it's
Okay.
not just autism, it's all kinds of developmental differences. So yours is, specifically ASD.
Okay, and it's nice to know about the younger group too, because we do occasionally get a call from somebody that's got a 14-year-old or even younger that's looking for a place to go.
Yeah, we'd love to have them. And what's really cool about these Zoom groups is previously people would have had to drive to EKU, but now they can be anywhere in the state of Kentucky and sign in.
So we're actually getting people from Indiana, and we may have somebody joining us from New Jersey just because it's easy enough to do on Zoom.
Yeah, that's cool. We aren't allowed to have people in our groups outside of the state because we're only licensed in Kentucky. That's the tricky part for us.
We don't have that issue with ASBG.
Exactly.
Yeah, so it's nice because even before COVID, where we've been posting on YouTube for how many years has it been, Sarah, since we've been doing that? We've reached a lot of people that way.
Time flies, so it's crazy. It's been a lot. I mean, we have a lot that Joe has socked away in our YouTube library. So we have a lot of views. And so this is something I want us to continue. I'm sure we will. I'm sure a lot of people will continue this sort of formatting even after they can meet in person. It's just been.
We have a question from Facebook Live. I'm about to post it.
And everybody else, remember, you can post questions in the chat or on Zoom or on Facebook Live, or you can turn on your microphone and ask it.
Whose sandwich is this?
You can have it.
Oh, okay. Is that American cheese?
Diana, we need to make some t-shirts. We need to make the facing fears, fights fears, fleeing fears, feeds fears t-shirts. I really need that.
I thought that was genius. That was just the peak.
We're gonna have to.
What's going on?
I would buy it too. I would totally buy that shirt.
Be front and back.
That's my next project, guys, after lunch.
Hey, you can design it on Custom Ink. I designed t-shirts for Thatcher's fundraiser to get his dog.
Custom ink. Good
Custom
idea.
Ink.
That sounds fun. Thanks, everybody. Again, we appreciate the invitation to be here. It was a pleasure. I'm so proud of my students. Aren't my students amazing? Can everybody
Oh
give
my gosh.
a little reaction for how amazing they are?
Yes.
I'm bursting with pride.
Joe, did you say you were about to place a question up here from Facebook?
I think she got it.
Oh, you did it? Okay.
Yeah, I covered it.
I
Yeah.
did, and Dr. Bundy answered it, and then I put the answer in the Facebook Live.
Awesome.
So
okay.
Somebody out there is going to make my t-shirt. It's just a question. I'll just let me know when you get them made and I'll buy one.
Oh, I see it. I see it.
Facing fears, fights fears, fleeing fears, feeds fears.
Oh yeah, that was fantastic. Well, I really felt such a sense of accomplishment for something that I didn't contribit to at all. I thought this was great. I'm serious. I thought it was great.
You got us together.
It's better than, I think in some ways it's better, easier way to receive the information, receive all the content than having to physically gather. So
yeah, let's do it again. Let's do it like this again. I loved it.
I did too. Good. I'm glad you did. And I hope all the other presenters enjoyed it too. We really appreciate it. I thought you did great. I thought all the content was very good. Well put together. All your graphics were great.
we're getting several thank yous on the Facebook Live as well.
That's awesome. I thought that you had, I feel like you have presented this before. It was so good. I thought, and you may have used this elsewhere, but you did a great job assembling all the materials up. If you have any announcements for anything upcoming at EKU besides the social groups, let us know. Everyone can recall, I'm told of our upcoming meetings, which you can find on our Facebook page. But
Whose chips are those?
okay, I'll let you know just, and Melanie, you can correct me if I'm wrong, but our meeting this month, which is February 22nd, the last Monday of each month, generally, will feature Marissa Webb of Lexington's Human Rights Commission, and she'll be talking about social support service animals and housing. And I think that will touch on some legal issues there. And then our March meeting, is this right, Melanie? Melanie is our wonderful programmer. She's the reason we're all here today. Our March meeting will feature Dr. Paul Wayman of Virginia Commonwealth University on employment and people with significant support needs. And then our April meeting, is this right? Is this the right month? We will again see Dr. Myra Beth Bundy, and she'll discuss obtaining an ASD diagnosis in adulthood. Is that right?
Well,
It's not April. Is it June? It's June.
Yeah, I think Dr. Wayman can't come until April.
Okay.
And then Dr. Bundy was kind enough to consider coming later.
When
and I was going to,
exactly?
I think it's June, the June, last Monday of June.
The last
If
Monday.
that, yeah, if that works for your schedule.
So
And we
that's
were gonna,
June 28th.
June 28th. Yeah.
Okay, I'll be at the beach, but what the heck?
Oh, whoa.
It's okay.
oh no, we can
I've
do
got
it another
Wi-Fi there.
time.
It'll be fine.
Oh gosh, we don't want to interrupt your time with your family.
We can adjust that.
Yeah, it's
People-
just an hour, right? It's just 1 hour.
Well, 2 hours,
Yeah.
Yeah.
usually.
Okay.
We can discuss.
Yeah,
Okay.
we can rearrange that. We can rearrange that, Dr. Bundy.
Okay.
So,
And I've
go ahead,
And I've
Melanie.
got for March, I think I have somebody that will talk on executive function deficits or executive function challenges. So, but I
Okay.
haven't confirmed it yet, so I didn't put it on the schedule.
Awesome. Okay, so March should be executive function. Well, backing up, February will be on service animals and social support animals and housing. March should be on executive function challenges. And then April will be Dr. Paul Wayman at Virginia Commonwealth University on employment and people with significant support needs. And possibly June from the beach, but likely not. We're not going to make you do that, I don't think, Dr. Bundy. That would be my call. We were trying to do something else for June.
It's all good.
And
We'll
let
figure it
you-
out.
Okay, but whenever we have Dr. Bundy grace us with her presence again, we'll be on obtaining an ASD diagnosis in adulthood. Okay. Well, everyone, if you have other questions, try to jump in with them quickly before we wrap, but I think we're going to go ahead and wrap and thank our presenters, all of them, very much for joining us today. And thanks to Joe for making this possible. Joe Grayson, our tech guru, and
No
Myra
problem.
Beth Bundy and Melanie Tyner Wilson for getting it together.
Yeah, I
Okay.
think I want to have Joe with me with every single Zoom presentation I do. The
Right.
polls, the way you integrate it with Facebook Live, I mean, fantastic, super professional. You really made it, you really enhanced what we could do.
I told her you can't detect that she has any anxiety at any point because everything is so smooth.
ADHD for the win today.
Hey.
ADHD power, yeah.
Yeah.
Hey,
it's your
neurodiversity is
superpower.
very important. There are a lot of strengths in being neurodiverse.
Absolutely, 110%.
Yeah, your superpower. All right. Well, thanks to everyone who was able to join us today on all the platforms. Joe, if you'll tell people, I guess they're seeing this on Facebook Live. So thanks to everyone who was able to join us, and we'll let you know when we're going to do something similar again. And Dr. Bundy, if you have content that your students are itching to get out there, let us know.
Okay, thanks.
Honestly, we would be happy to make it happen.
One of the things that might be fun in the future, so every spring we have a round of doctoral specialization projects that the students do, and they're often fairly practical. So it might be kind of fun that, you know, once a year, once every couple of years, we could have the students come in and share autism related doctoral specialization projects. We've done that for the ARC conference before, and you guys might enjoy that.
Oh, I love that. Honestly, get in touch with me or Mel, and I would love to do that. I would love to present that.
And what's cool about that is the students can present what they've done, and then you guys can give feedback, you know, back to the students so they can add to their project what your audience thought about it and ideas that they had. So it really could be a reciprocal process.
Oh, would love to do that. We'd love to host it. Let us know when it's ready.
All righty.
Yeah, okay. All right, everyone. I guess we'll say goodbye for today. Thanks to everyone for being here.
Bye. Thank you.
Bye.
Bye. Thank you, everyone.
Bye, thank you.
Bye,
Stop
thank
the live
you.
stream.
I switched over from Facebook to the Zoom.
There you are. Awesome. Awesome.